Hello everybody, my name is Landis Stockham and I'm a student at Eastern Kentucky University in their Psychiatric Mental Health Nurse Practitioner program, and this is my project proposal presentation. And the healthcare problem that will be discussed in this video is depression rates among adolescents. And the depression rates among adolescents, according to the United States Department of Health and Human Services, in 2008 was 8.3%, and their goal was to decrease that down to 7.5%. But that has been ineffective. As of 2015, that percentage has increased to 12.5%. And an interesting fact is, if you look on their website, not only has there been an increase in depressive symptoms among adolescents, but the suicide rate has had nearly an identical increase over the exact same time period within the exact same population. So in theory, there is a definitive link there. So the purpose of this project was to evaluate the effectiveness of cognitive behavioral therapy in adolescents. And that is significant to us as advanced practice nurses or future advanced practice nurses, and that we will be in a position to manage this population and their depressive symptoms. And it is our responsibility to investigate all interventions that could potentially help those that we are taking care of. And one of those interventions is cognitive behavioral therapy. And as a FNP or a psychiatric mental health nurse practitioner, either one of us would be in a position to potentially prescribe, deliver, or refer for cognitive behavioral therapy. There is plenty of literature out there that supports the effectiveness of cognitive behavioral therapy. Clark in 2016 performed a study of 212 adolescents receiving cognitive behavioral therapy or treatment as usual in their control group, and utilized the CESD scores to measure depressive symptoms throughout the study. Wigenhoven in 2014 performed a similar study with adolescent girls, and they used the Child Depression Inventory to measure depressive symptoms. Saranya, 2017, performed a cognitive behavioral therapy computer-based program with 84 juvenile adolescents, and they used the Patient Health Questionnaire to measure depressive symptoms. And those three studies are all level 2 studies of evidence. And the fourth one is a level 3 in that it does not have a control group, and the purpose of that was to create a study that was more in a real-world setting. That was performed by Margit and Idso in 2014 with 107 adolescents, and they used the Beck Depression Inventory to measure depressive symptoms. In conclusion, all 4 of these studies concluded that the intervention of cognitive behavioral therapy significantly decreased depression and depressive symptoms within the adolescent population. The proposed intervention plan for my project will take place at a New Leaf facility, which is a facility here in Arizona that provides mental health services specifically to the adolescent population. These individuals will be screened at the New Leaf facilities using the CESD scores, and if they qualify for depression or depressive symptoms, they will fit the criteria for this project, so long as they don't have any significant other mental illnesses. The idea is to deliver CBT over 1 year and measure the CESD scores prior to the project at 6 months, 1 year, and then 6 months after the project and the CBT therapy sessions have ended. And again, utilizing the CESD scores to measure depression and depression symptoms. They will be offered weekly, and so long as these participants attend 20 sessions, the information can be utilized for this project. And In closing, it is us as advanced practice nurses or future advanced practice nurses to research and find these interventions that have been shown to be effective to whatever population that we are looking into, this one being cognitive behavioral therapy. Cognitive behavioral therapy is perhaps an underutilized intervention. Oftentimes we see adolescents and even adults that are just receiving antidepressants and not taking full advantage of the interventions that are available to them to relieve their depression and depressive symptoms. And it is our job to provide the education, referrals, so that they have all the tools necessary to enhance their quality of life. And that is the foundation of nursing and nursing practice in healthcare, is to improve those that we take care of. It's to improve their quality of life overall in any way that we can. And part of our job is to look at the interventions that are new and upcoming and show promising results to do that, and it will help us to perform our jobs well, to perform our jobs better, and to improve the quality of life of those that we take care of. And that being said, I'd like to close this video. Thank you.